Good morning, everyone. I am MC-2 and I'm going to report about a Krabbe'S disease. So first of all, do you have any idea about this topic? So if not, I'm going to explain to you if unsay naaani nga disease, kung unsa siya ka mag-contagious ba siya or di, or kanang asa siya gikan, kung unsa gid siya, kung unsay mga kanang symptoms or treatments ani niya. So Krabbe'S disease is a genetic disorder of nervous system. It is a brain disease that called leukodystrophy. So leuko means white blood cells, and then the dystrophy is a disorder in which an organ or tissue of the body wastes. So mo to siya guys no. So nag-focus gyud day siya sa ang brain, which is our nervous system. So ang ganing sa tuong brain sa spinal cord, if mo ginay ka ng sana impact yun niya ba mostly ma-impact yun niya ang kaning disease. Kay based on sa akong na research, kay karang dili giday nga anay kadali dayon mahibalan sa mga nurses or sa mga doctors, and then bisag ang imong parents nga nakakita na ganang nakabaguhan silang anak kamo ni nga naigipamati nga symptoms ana, which is akong i-discuss after ani. Dili siya dali mahibalan nga nali siya Krabbe'S disease, kay rare di kini siya nga disease. So the white matter made up of specific cells and substance nga gitawag siya myelin. Which is ang myelin kimo na siya ang in solution around our electrical cord of our brain nga mo allow ta, for example, to speak, to eat, to talk, to walk, and even breathe. And sumo na siya nga kanang ang myelin di ay kimo na siya mo allow na to ba nga mo na buhaton nato, silbi mo bitaw controller ana bitaw. So mo na siya if nagi white substance, specific cells and substance, gitawag na siya og myelin. Mostly ana makita na siya sa ato ang brain, spinal cord, and sa ato ang kanang mga nerves mo murag mo dapot bitaw sila ay mo pilit to something say term na ay sama na siya. So mo na siya no. So the history of this one is it was first described in detail in 1916. So na discover din siya pag 1916 ni Nod Krabbe. So Nod Krabbe from his name, kay gigamit niya iyang name as a disease kay siya may na first nga naka-discover aning Krabbe'S disease. So, Krabbe'S disease is a global cell leukodystrophy, the galactosylceramidase deficiency, and galactosylceramidase deficiency. So, muna siya mga enzymes niya. So, sa mostly ang kaning galactosylceramidase, kay makitaan niya siya sa kung sa autosomal recessive nga genetic condition that affects the galactosylceramidase, which results enzyme deficiency of galactosylceramidase. Makita nato ni siya sa kanabitong sa chromosome pairs. Makita na siya nato sa ika-14 nga chromosomes. So ato sa basahon ang definition sa Krabbe'S disease. So the Krabbe'S disease is a rare genetic disorder of the nervous system. It's a type of brain disease called leukodystrophy. So mo na siya kasagaran sa mga pictures mga now mostly affect ani kay the infant or adult. Later ako i-discuss kung what age, pila ilahang life expectancy, mga so mga leukodystrophy, and then what are the disorders in our nervous system. So yes, nako you ask before ko mo proceed ato do you have any idea kung sa mga disorders at our nervous system? So if wala, so ang disorders at our nervous system defined as that affect the brain. Mostly ang ma-affect yun sa ito ang nervous system is our brain, as well as our nerve nga makita na to sa tuang kanang lawas sa tuang spinal cord pod. structural, biochemical, or electrical abnormalities in the brain, spinal cord, or other nerves can result in a range of symptoms. So muna siya no, kung di ba ang Krabbe'S disease kay mo maapektuhan magid atong nervous system. So mainly ang maigo gyud aning nga maapektuhan sa atong lawas kay mainly gyud ang brain, the spinal cord, and other nerves sa tuang human body. So yes, let's proceed. So what is myelin? So motohong yung story ganina no nga. Ang myelin is an insulation that around in our electrical cord of our brain that allows to speak, to eat, to walk, or either even breathe. Basta something like that nga definition as para mas masabtan. So dali like ay kanang same ra sila thought pero mas kanang gi-shorten ako ba aron dali ra masabtan ang word nga myelin. So myelin is an insulating layer or sheath that forms around nerves, including those in the brain and spinal cord. It is made up of protein and fatty substances. This myelin sheath allows electrical impulses to transmit quickly and efficiently along the nerve cells. So muna siya no, muna siya ang myelin sheath, this one. So if mo function na siya, if mo ikanang sa tawagan ni kanang for example, sa atong brain is mo ingon atong brain nga gigutom. So murag ang myelin mo control mo allow siya nga sige go adto didto kay para mo function ta nga kung gigutom ta mangita tag food, which is mangita atong lawas og food mo na mo lihok ta kay mo hikay ta, something like that. And then what are the causes of Krabbe'S disease? So a defect in the GALC, which means GALC means wait, nalimot ko sa meaning. Okay, galactocerebrosidase. Yeah. Galactocerebrosidase gene causes Krabbe'S disease. So ang kaning GALC is muna siya ang enzyme nga naa sa Krabbe'S disease. So without it kanang tawagan ni kung wala na siya kanang sama gud sa ubang mga disease nagi siya yung mga kaugaling enzymes. So yeah, so people with this gene defect do not make enough of substance called galactocerebrosidase beta-galactosidase. So kanang moto siya no ang kaning galactocerebrosidase makita na to siya sa chromosome pairs sa ika-14, which is dari. So makita na to siya ikadari nga 14 because the body needs these enzymes to make myelin. So mo to siya kung wala day ani di ay so mo to siya kung akong gustong itubag di ganina. So kung wala day ani nga enzyme, our body needs this enzyme to make myelin, which is mo na siya mo allow na to no kaya para ma-protect sa tungkuan yung mo allow po to sa kanang sa paglihok or something ana. Then myelin surrounds and protects nerve fibers. Without this enzyme, myelin breaks down. Brain cells die and nerves in the brain and other body areas do not work properly. So mo to siya dari mas specify gid dari nga ang kung wala gid aning enzyme ang myelin mo breaks down kuno ang brain cells kay mamatay and ang nerves pod ang brain sa tong lawas kay dili na mo function og tarong. So mo to siyang chromosome pairs, this one. And then Krabbe'S disease can develop at various age. So muna siya ang two types sa ato ang sa kaninga disease, which is the early onset and then the late onset. So the first one, the early onset, this disease will form the children with this form of the disease die before they reach age 2. So mo to siya no kuyaw kay siya di ay kay so wala pa gani sila maabot anang idara age 2 na possibilities nga mamatay sila dayon pero nakoy usa nga na research nga kanang sa tawagan ni kanang nay usa nga nilapas og kani nga idara which is the 3 years old kanang nadapat to niyang sakit and then after that na matay siya kay lagi ang kaninga disease kay wala siya treatment kanang nay mga therapy nga gina-process karon lang ay karon nga generation ba na gina-process nga therapy or something nga medicine nga i-take sa mga ningon ani nga sakit, but kato nga bata ang ako na search sa YouTube kay na-survive pa siya, di ba ang giingon sa early onset kanang they die before they reach age 2. So mo to siya no kanang naka-survive pa siya at sa iyang pangidaron no nga inato pa niya bisag galisod na siya pero naka-survive pa siya. So mo to thankful kay siya nga nalapas to niya nga kani nga set, which is dili pa siya yung thankful pero at least ba kay mostly mo sa research is at the age of 2 ay before nga maabot sila sa 2 kay mamatay sila, so siya naabot pa siya 3, so nadapag yun niyang kagalingon. And then the second type of this disease, the late onset. This one, the late onset. So Krabbe'S disease begins in late childhood or early adolescence. So mostly sa mga adults na no kanang mo pagsugod nila binata and anang ang pangidarona. Nakoy pictures sa rigid nga gi specific ang age and then kung kanang unsay mga symptoms niya kana nga pangidarona and then kung unsa poy life expectancy sa kana nga age pod. So wait sa ako ato ng mga hisgutan karon. So what are the symptoms of early onset of Krabbe'S disease? Are changing muscle tone from floppy to rigid. So mo change ilang muscle, di ba? Kanang sa tawan mostly anak kay kanabitang kanang murag manggahi pa dilang lawas in murag mo ana ilang kamot, then ilang body is huey, something like that, and then ang ilang face kay murag na stroke in ana ilang mga muscles murag manggahi bitaw, and then magkalisod po sila pandungog hearing loss that leads to deafness o hantod mabungol na gid sila, failure to thrive, feeding difficulties. Ay by the way, kani ding Krabbe'S disease is dili na sila kadali og kanang intake og mga bisag unsa nga foods, bisag pag unsa na siya ka call na ni kanang bisag unsa pa na siya ka humok, bisag unsa pa na siya ka nutrients, kay kanang dili gid sa kadali-dali og kanang intake ana nga food kay masuka nila, dili murag di sila kadawat og food silang stomach bitaw, like bisag ihungit pa lang gani nila ilahang ang food, gipatan pa lang silang mouth, kay murag di nila na maswallow, kay murag na naka-block something silang throat, yun ana ilang ipamati based ako ang na-research na sa YouTube. And then, irritability and insensitivity to loud sounds, severe seizures may begin at a very early age, unexplained fevers, vision loss that leads to blindness, and vomiting. So, sabot-tabang raman kina ang mga symptoms no nga sa kaninga early onset nga gipamati. And then sa the late onset, lahi pud siya na kalahian kay di ba dari kay mas sa early onset mas daghan siya kanang mga symptoms. Sa sa late onset, which is the adult nga ilang gipamation, kay kanang sa ako ang na-search kay mura ni kong upat nga nakuha nga mga sources or references, which is vision problems may appear first, followed by walking difficulties, rigid muscles. Symptoms vary from person to person. So, mana siya, patagi na siya. Sa botablo naman pag na siya. So, din na ako siya explain palayo. So, what are the exams and tests nga pagabuhaton di ay ani nga disease? So, tests that may be done include blood test, the CSF total protein, which means the test that amount of protein in the cerebrospinal fluid, and then the genetic testing for the galactocerebrosidase gene defect, and the MRI of the head, the nerve conduction velocity. MRI kay mo na siya kanang imrag CT scan bitay mong ulo, kanang magnetic resonance imaging ba kanang something sa tawagan ni kanang murag iana imong head ba basta manana siya. And then what are the treatments? So as what I've said earlier nga there's no cure specific treatment for Krabbe'S disease, but as of now, based on my research again, kay naay kanang nag-process na sila mga medications or kanang something nga ma-intake nila bisag katong akong nakitaan kay murag fluid to akong nakita, fluid, and then ano sa to basta ka ng mga tablets akong nakuan na research, and then napoy therapy nga ilahang ginabuhat, pero dili gyud inin anak kadadali nga ma-effect sila nga maayo din sila, okay sila, ano bitaw. So some people have had a bone marrow transplant in the early stage of the disease, but this treatment has risk. So akani nga akong gibutang diri nga treatment is based po ni sa akong nakitaan sa YouTube nga kanang therapy man siya no, pero ningon man tong iyang parents nga wala gilaing pag-asa doc if kanang para ma-survive niya mong anak, ingon din siya nga ato i-try o kanang i-transplant ang iyang bone marrow if makaya ba, pero risko kasi kinabuhi. So mo to ni gogil ilang parents kay pagkangalang na ay kanang other way nga ma-survive ilang baby or ilang anak, so mo to ilang gi approvean nga magpa-transplant ilang bata. So after ato wala lang kapag pila ka months namatay din ang bata. And then this one, the disease classification, the early onset and the late onset, which is early onset na din early infantile 0 to 6 months, and then the late infantile 7 to 36 months. So first ari sa ta sa early infantile. So ang symptoms din ng early infantile kay muhilak nga kanang irritable siya sa kagalingon when maghilak siya, and then kanang maglisod og kaon, sakit iyang ulo, kanang fisted hands like this, kanang murag manggahi, and then di siya ka-control gid ba, and then developmental delay, and then the disease progression of this early infantile, progressive neurologic deterioration, seizures, psychomotor regression, loss of vision, hearing, involuntary movement. And then ang iyahang survival or life expectancy aning early infantile 0 to 6 months is 1.5 to 2 years. So mo to siya no, kanang mutong gingon ganina nga before they reach at the age of by 2 kay na possibilities gyud nga mamatay sila. And then the late infantile, which is na belong gyapon siya sa early onset kay 7 to 36 months maning late infantile. So ang symptoms di ani niya ka similar to early infantile, same rin ni sila. And then ang disease progression sa late infantile is similar to ani gyapon, but ang iyahang life expectancy is 9.5 years, so almost 10 gyapon na siya no, pero at least na lang madadapan niya nga yun ana nga pangidaron. And then sa late onset na ta, so the first one is a juvenile onset 3 to 15 years. So what are the symptoms of this one? So vision problems, muscle weakness, gait changes, loss of the developmental milestones. The disease progression is variable progression with older patients, generally experiencing slower progression, and then the life expectancy is 16 years. So imagine 16 years, so bitahan na lang gid no compare sa kanang sa kaning early onset. And then for the adult onset above 15 years is symptoms ani kay gait disturbance, weakness, lower limb hypoesthesia, cognitive regression, spastic paraparesis. And then the disease progression is the variable progression with older patients generally experiencing slower progression. And then the life expectancy of this one is 33 years. So let's proceed. So mo to siya no, ang kaning Krabbe'S disease is a genetic disorder which is inherited by their parents. So kanang masabtan naman ni autosomal recessive inheritance pattern no, kung both parents na ani nga sakit, may possibilities nga naagid anang bata. So ang isa wala, i-career niya ang isa wala. So nagipon siya half lang pod, pero na possibilities nga maka-feel siya nga sakit or makaagi siya ng sakit kay na may sakit iyang mama or yung papa baron. So mo na siya kanang posibilidad nga kanang makuha gini ang kung unsay na siyang parents. So the sa case study na ta. So the case study is a 6-month-old male patient was born full term to G1P1 mother was via vaginal delivery. So G1P1 is kanang ang mama kay nakaagi og one pregnancy and one delivery one pregnancy ug naka-deliver na pud siya ika-isa. Pero bitong kanang dili nakabalik og panganak, murag kana mong gurang term ang ay but pasabot ng G1P1. Kanang sana I don't know if I'm right or wrong, but asang sa kung pagsabot kay mo na siya G1P1. And then with a remarkable prenatal and birth history. So nahitabo ani nga pagpanganak niya nga di niya ay kanang nay bad bitaw. And then early developmental was remarkable. At 4 to 6 months of age, blank stares. So ang kanang blank stares kay mura bitog siya kanang ihang pananaw kay unsay tawagan ni kanang nanay pagka wait, nalimot ko sa term. Nanay vision, iyang vision ba kay na bitoy diferensya. Kanang murag blurry na bitaw like that. Muna siya. And then, the poor head control and signs of developmental regression, such as loss of previously made sounds, were noted. So, by the way, ang ihadi population estimate kay occurs in approximately 1 in 100 people. Male and females are affected in equal members. So, 1 in 100 thousands people ang naaraan ng disease. So, rare education, no? So, moto siya ang case study na ako. That's all. Thank you.
I just remember the day she was born, this nice long black hair.
We welcomed her with open arms and we're thrilled to have what we thought a healthy baby girl.
Be able to make a phone call to my parents and say, hey, look, we have a daughter.
She passed all the newborn APGAR test. We brought her home and enjoyed her for the first month and a half, and then
things just didn't seem right.
She was literally crying all day long. It was going on for weeks, and the irritability kept getting worse. The acid reflux was projectile, and it was taking more than an hour to get an ounce of food down her. The doctor had said she's got something serious. They were looking at 2 different diseases. One was biotenidasis disease and the other one was Krabbe'S. Well, as a parent, you go home and you get on the internet and you search and you Google and you're like, yep, pretty sure she has Krabbe'S.
I think that's when I heard that word for the first time and still didn't have any clue exactly what that was.
So it was a deadly disease that affects the ability to make enzyme for myelin, which is the sheet that covers your nerves and allows for proper signal transmission from your central nervous system to the rest of your body. And without that, you're not able to survive. And went home empty, feeling very empty and at a loss of what to do with our child.
It was either a wet noodle that just kind of folded, that there was just no muscle strength whatsoever, or it was as hard as this board here. She was just so stiff, everything would just contract.
We felt like we were losing her every moment of every day.
What is this? Cute.
We had just finished celebrating our first Christmas. She was not feeling well whatsoever. And on the way home, that's when we made our first visit, true visit to Children's Hospital.
She was about 10 months. We had to make some difficult decisions on whether she was going to be intubated or not, and because she had a double lung infection and one had collapsed. We just weren't ready. We thought we would be ready. They tell you, they kind of prep you, but you're never ready.
It was just like a roller coaster. It was up. I mean, she'd have these fantastic days, and then there was, you know, just hours later, it would be...
We lived every day to the fullest. We enjoyed family, we enjoyed friends. I worked very little outside the home. We had great support from family and our nurse Karna, who was amazing, and we always wondered if we were doing the right thing.
Try to dress her every day the best I could, and try to do this and try to do that, but just a lot of the little things that you would do, little conversations, and you get these nice little responses.
Little things like raising her hand, or a cute little sneeze that she did, or this bouncing of the legs that I thought at the time was her own will doing this. We thought it was so fun and cute, and we would let her bounce her legs off the end of a bed or a couch or something. And then honestly, after we showed the video to some specialists, they actually said it was seizure activity. And I was mortified, because we would do this often with her just to get some kind of feedback from her that she was in there, that she, just something. One thing that I had with her was her hair. I loved doing her hair. I liked to put it in rollers. I liked to braid it. It was just one of those girly things that I got to do with her. The fact that we had to shave it off broke my heart. I mean, it was like taking a piece of her away. I knew at that moment that she was slowly, more than slowly fading away. She was quickly fading, more so than I wanted to believe. They said that she wouldn't make a year, and she did. And so when you get those little wins, it was wonderful, because we felt like maybe she could live to be 3, 4, 5 years old.
But I know one thing, she was a fighter, and she outlasted a lot longer than any of us ever expected.
And at the very end, she developed hydrocephalus. It's actually somewhat common, and it's easily resolved, and you put a shunt in, but the first shunt failed. Within a month or two of that surgery, she passed away in our arms at home.
I guess that it affected me more than I ever expected it to.
So as we were doing looking for different research and things that were going on, there just was limited resources out there for families with children with Krabbe'S disease. And so being a family that's gone through this, I wanted to be able to use our experience to help educate other families or be a resource to them. I believe that if we all work together, the researchers, the pharmaceutical companies, and the clinicians, we can find a better way for these children to live with good therapy, and there will be a cure for the disease. It may take us another couple years, but there will be. There's been significant advances in Krabbe'S disease, and I am excited that families don't have to go through what we had to.